There's a lot of discussion right now about what the Medicare Part B premium is going to be for 2024, especially in light of the recent FDA's approval of a new Alzheimer medication. And so we're wondering, what will the Part B premium be? And secondly, will there be enough cost of living adjustment and Social Security checks to cover that increase? Well, we don't exactly answer the questions, but there is a tremendous amount of very reliable information coming out of Washington, D.C. right now that I think we can get a good idea as to what to expect. I'll explain that in this video. So as we look at the future of the Part B premiums, and now we understand how that number is going to be arrived at, I think it's helpful for us also to look at the history of Part B premiums and how they have increased, so that we can kind of see exactly how the government is going to make some adjustments for 2024. So let's talk about the history of Part B premiums. So we'll go back just 4 years to 2019. This is what the Part B monthly premium was. Now remember, that is the income threshold that is established. So anyone that was below those income thresholds, remember what I said this year, $97,000 for a single filer, $194,000 for a married couple that files a joint return. If they're below those thresholds, they pay what is called the base premium. This is the base. Some people refer this as the standard Part B premium. Either way, those words are going to be synonymous. So that's what the standard premium was in 2019. In 2020, there was, as you can see, an increase. It went up, $9.10 into 2020. For the base premium. In 2021, this is actually a very small increase. It didn't go up a full $4. It went up $3.90 moving into 2021. Now, this next year, we then would see in 2022 the highest increase that's ever occurred in Medicare. Now, remember, what had to happen as they're working on the 22 number, they're dealing with COVID and also a new Alzheimer medication that was actually approved called Agilum. And it was approved, and so they thought there was going to be a lot of use for Agilum. That didn't work out. VA said they didn't want to use it. Cleveland Clinic said they weren't going to use it, so it was not nearly as highly as popular as they thought. But they didn't know that as they were making that projection into 2022. And that's what caused the high increase here, the highest increase that ever occurred for Medicare Part B premium. As you can see, it went up $21.60. And that was because of COVID expenses that the government was now incurring, as well as that Alzheimer's medication, Agilum, that was approved, okay? And so we saw a huge increase. Well, what happened? The government, as they looked into 2023, they realized Agilum was not highly effective nor popular, it was not used, and so they really had over projected. So that's why we saw a decrease in the Part B premium as we went into 2023. So we actually saw this go down $5.20 because of that over projection. All right, and so that's the history of Part B premiums. And you can see there's kind of a little bit of ebb and flow. Typically going to go up a little bit, but this is the decrease because of those over projections. Hey, just real quickly, if you're finding this video to be helpful, you can like, comment, and subscribe. And if you do so, that'll let YouTube know that this is helpful information, and they'll send it out to others who also need to learn about Medicare. Now, let's look at then as we look into 2024. So we're just talking about projection. Again, this number will not be out until probably around the end of September, but we do have some good ideas as to what the government is thinking right now. And so first off, what they did is just a few months ago, they gave us some preliminary information. And so there was discussion that the Part B premium was actually going to go up $9.90. Now, why not an even $10? I don't know. But they were projecting that was going to go up $9.90. So that would have put us at $4.80. Okay, so that'd be $9.90 increase. Again, this would be that base premium based upon income most people are going to pay. And just so you know, that's about 93% of the population that actually pays that base. Only 7% of the people have to pay the additional amount. But this number was projected before the FDA had actually approved this new Alzheimer medication. Okay, and so now there's some believe that they're going to probably have to add approximately $5 so that this Alzheimer's medication can also be covered, again, for people that are on Medicare. Okay, so what is that going to put us at? That's going to put us at $179.80. So you can see we're going to go up not quite a full $15, but very close. And so here's the point. Again, I want you to know, I'm stressing we don't know that for sure, but again, they're very reliable information, some sources out there that are saying this is what we're probably looking at. And again, this could be higher, could be lower. We certainly don't know that, but again, that's kind of the projected numbers for 2024. So the question is, if it does go to this, what impact is that going to have upon people's Social Security checks? Because if you're on Social Security, you're actually paying for your Part B premium out of your Social Security check. If you're not, then they bill you for that quarterly or do a bank draft. But the point is, will the cost of living adjustment that is being discussed right now going to cover that increase in Part B premium? Let's look at that next. Now, when it comes to Social Security, we know that people can begin taking Social Security as early as 62, and they should always take it by 70 because it can't not grow beyond that. And so once someone has established their, what we call their primary insurance amount, their amount that they're going to receive from Social Security at full retirement age, if they go early, they take less. If they go later, they actually grow that amount. So, but it's called the primary insurance amount. So right now, the average recipient on Medicare is getting right at $1,800. Okay, and I know there's some getting more, some getting less. That's just simply the average. And so the discussion right now coming out of DC that seems to be really the most reliable is we're expecting somewhat of an increase right around 3%. A 3% increase. But let me explain how this works. What happens is every year, again, 2022, what they do is the third quarter of the year, all right, they actually take an index, which is called the Clerical Workers and Urban Wage Earners Index. And what they do is they take the cost of goods and services that those people would be buying, includes all kinds of things, and they look at that actually in the third quarter of the year, okay? So the cost of goods and services for the third quarter of the year, and then they compare that to the next year. So this is going to be 2023, and this would actually be July, August, and September. So that's going on right now. So the cost of goods and services for 2023. And what they do is they make a comparison. And so if the cost of goods and services is higher here than here, they take the percentage of that difference, and that's what becomes our cost of living adjustment. So that's the formula that they track. And so right now, there's many that believe we're going to be right around that 3% range. Again, this is just speculation right now, some good educated guesses. But if that happens at 3%, what's that mean? The average person, that $1,800 check, their check is going to go up by $54 a month. Now, if you're receiving a check of $2,000, then it's going to go up $60. So as you can see, if we get a cost of living adjustment around that range, we know it's going to be enough to offset that about $15 increase in the Medicare Part B premiums. And again, it's sheer speculation right now, but with all the inflation that we've seen, even though it's starting to, it seems like to kind of soften, I do believe we're going to get some kind of a cost of living adjustment. And so that should be enough then to cover the additional cost that's going to be incurred by this new Alzheimer's medication. So I want to begin by actually looking at this particular medication that was approved by the FDA just recently. It is called Leqembi. Now, Leqembi is actually manufactured by a Japanese company that is called Eisai. Eisai would be the one who would certainly hold the patents to this particular medication. But in conjunction with a company that's a U.S. company called Biogen, this company will actually be someone that will be marketing it in the United States. All right. Now, when you think about the patients who will be prescribed Leqembi, it's going to be those that have mild dementia or other mild symptoms with Alzheimer's disease. Okay, this is not for people that have Alzheimer's dementia in a very serious state. It's never proven yet to reverse it. What it does, it is proven through some pretty extensive studies to actually slow down the progression of the disease. Okay, and so that's who will be receiving it. Now, as far as the prescription itself, it is an IV drug. It will be administered IV, and when people take it, there's actually two different dosages. There's actually a 200 milligram dose as well as a 500 milligram dose. And so this dosage actually will be administered every 2 weeks. And because it is an IV medication, of course, it's going to have to be professionally administered. Now, as we look at another aspect here would be the side effects. And this really is a big issue because Leqembi, as well as other meds that they're working on for Alzheimer's and dementia, do have a common side effect, and that would be swelling of the brain as well as a bleeding of the brain. And so what happens for someone to actually be able to be prescribed this, number one, the doctor has to prove that they have this sticky plaque on their brain, because that's what these drugs are designed to do, is to actually clean out and clear out and remove the sticky plaque on the brain that people believe leads to Alzheimer's and dementia. And so first off, doc has to prove that the patient has that problem, and then what has to happen, they have to continue then to have monitoring of how this medication is working. Why? Because of the swelling of the brain and bleeding of the brain. They want to make sure that does not occur. So we have those side effects that then will be professionally monitored. And then lastly, as we talk about the cost. Now, the cost of medication, again, it's administered every 2 weeks for an annual dosage. So for 1 year, they're calculating that expense to be $26,000. And so because it is a professionally administered medication, it's actually going to be covered through Medicare Part B. Those of you that are familiar with Medicare know that some medications in the hospital are covered by A. Some medications that we self-administer are covered by Part D. But Part B medications are for those that are professionally administered, typically in a doctor's office or some kind of outpatient setting. And so that's why this particular medication will be covered by Medicare Part B. Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out. So we have a very expensive medication, $26,000 a year, that's going to be covered through Medicare Part B. And so I think it's important for us to really understand how Medicare calculates the Part B premiums on an annual basis. Now, the work of calculating the Part B premium is always done about 9 months in advance. And so right now, today, by the way, is July the 19th, 2023, as I'm shooting this particular video. So what's happening right now is Medicare is actually calculating and projecting what they think the 2024 costs are going to be. And so they begin this work really at the beginning of the year and just continue to work, and then announce that actual Part B premium towards the end of September. Okay, so that'll be coming out here just in a couple months. But they're working on that, and all they can do is try to project, and of course they want to be as accurate as possible. All right, and so we do know exactly what that number is for this year, 2023, because those of you on Medicare are paying that. All right, so here's how they arrive at the Part B number. So first off, what they do is they have to project what they believe the total costs are going to be for Part B coverage. And remember, they're doing this looking into what they think it'll be for 2024. And so they take that total, which is, probably $1 trillion or more, thereabouts, something like that. And they take that number and then they divide that number into the number of recipients of people that are actually receiving Part B benefits. And right now that's in the neighborhood of about 66 to 67 million people or so. So total cost of coverage projected for 2024 divided by the actual people that are covered by Medicare Part B that were receiving coverage for Part B benefits. And then that comes up with actually the annual cost. All right, so this would be the annual cost of covering those people, okay? And then they take that number and then they divide that by 12. Well, why is that? Well, because people pay their monthly Part B premiums on a monthly basis. All right. Now, I know what that number is right now because what's happening, people that are on Part B, we have what's called a standard premium. And the standard premium for Part B right now is $164.90. All right. Now, to keep math simple, I'm just going to say it's $165. Because what happens is when they take this monthly number, the average recipient is only going to be paying 25%. So my point is what they're saying, to cover people in 2023 for Part B benefits, it cost them, the government, $660 a month. But the recipients on Medicare only have to pay 25% of that based upon their income. So watch this. So anyone that is a single filer, they file a single return. Single person does file a single return as long as they're what is called modified adjusted gross income. Modified adjusted gross income. Just so you know the formula, that's line 11 on the tax return plus line 2A tax exempt interest. That's modified adjusted gross income. So a single filer that is below $97,000 or less will pay $164.90 a month for their Medicare Part B, which is 25% of what it costs the government to cover them. And so the other 75% is being paid by Medicare. Now for a couple, a married couple that files a joint return, that number is $194,000 or less modified adjusted gross income. Then they too are going to pay $164.90, 25% of what it costs the government to cover them. Government pays 75%. Now, for those people that are above these limits, these thresholds, modified adjusted gross income, single filer above $97,000, or a married filing a joint return above $194,000, they pay more. So the government says that these income levels, you only pay 25%, the government pays 75%. But as my income goes up, I have an additional charge, which is called an IRMA. I'm not going to teach on that, got a lot of teaching on that, but it's an IRMA. It's an acronym that stands for Income-Related Monthly Adjusted Amount. And there's actually 5 levels of IRMAs based upon how high you are above these particular thresholds. There's an IRMA on the B of Medicare and an IRMA for the drug plans as well. In total, the lowest level is about an extra $80 above this, and the highest is about an extra $480. And then that would be the IRMAs that combined for B and D. All right, so just quick review. Total cost of coverage they're projecting for 2024 divided by the number of recipients gives us our annual amount. It's paid on a monthly basis, and so we know it costs the government $660 to cover you. But if our income levels are below this, then we're just paying 25% of the cost. If our income levels above that, we're either paying 35% or 50%, 65, 75, or 85%, depending upon where your income is going to be. All right, so my whole point is this. They're going to have to project how many people are going to be using this new medication that's now approved that Medicare is going to cover, and what kind of impact is that going to have on Part B.